So today we'll discuss about one of the cardiovascular disorders, that is angina pectoris. So before going to the pharmacology of angina pectoris, let us see how the angina pectoris is caused, what are the symptoms and diagnosis test. So angina pectoris. Angina pectoris is a cardiovascular disorder which is caused due to decreased oxygen supply to heart. That is, if the myocardial tissue of the heart is replaced, or if it doesn't get proper blood supply, then there occurs decreased oxygen supply to the heart. That is the reason angina pectoris is caused, where severe heart attack can be seen. Let us see the symptoms. Because of the angina pectoris, there may occur shortness of breath, nausea, and there may be severe chest pain, and there will be irregular heartbeat, and in few of the patients we can see even anxiety or nervousness, or there will be fainting also. And let us see the classification of angina. There are 5 types of angina. First one is stable angina or classical angina. Second one is unstable angina. Third one is a variant or prinzmetal angina. Fourth one is microvascular angina, and the last one is atypical angina. So let's see about stable angina. Stable angina is also called as classical angina, and it usually occurs when we are prone to exercise, when we do exercise or overeating, or if there is atherosclerotic disorder also, then there occurs stable angina, and it can be usually cured through rest or anti-anginal disorders. And the pain which occurs in this kind of stable angina is in a same manner. That is, the pattern in which the pain occurs is the same. And let us see about the second category of angina, that is unstable angina. Unstable angina is caused due to rupture of erythromatous plaque. That is, if a coronary artery rupture takes place inside the artery, then there occurs the coagulation of the blood, and thereby there occurs narrowing of the blood vessel, and the unstable angina is caused. And this is due to regular exercise. This may be due to regular exercise, but treated only when anti-anginal drugs are given. And third one is variant or prinzmetal angina. This type of angina is usually seen in the patients suffering from atherosclerosis. That is, if the heart or myocardial tissue is prone to myocardial ischemia, that is, if the myocardial tissue is replaced, or when it doesn't get proper blood supply, then there occurs decreased oxygen demand. There occurs increased oxygen demand to the heart and decreased oxygen supply to the heart. This is why variant or prinzmetal angina occurs, and it is usually caused due to spasm of the coronary artery also. In some cases, because of the coronary artery spasm, there may occur variant or prinzmetal angina, and it can be relieved through anti-anginal drugs. And fourth one is microvascular angina. Microvascular angina is a type of angina which usually occurs in the microvascular blood vessels. Apart from the large coronary arteries, there are few microvascular blood vessels which supply blood to the heart. When these microvascular blood vessels are blocked, or when there is improper blood supply in those kind of blood vessels, then this microvascular angina occurs, and it can be treated through common angina medication like anti-anginal drugs. In this picture, we can see the blockage of the blood vessel, microvascular blood vessel, because of the atherosclerosis, or because of plaques which are occurring in the blood vessel. And fifth type of angina is atypical angina. Atypical angina is caused usually because of shortness of breath, and this type of angina is usually seen in women when compared to men, and there may be discomfort because of the chest pain. Let's see the pathophysiology of angina. Why angina occurs? Every human, or in the human's heart, need oxygen to supply or purify blood and to pump blood to various organs of the body. But when oxygen demand increases, then the oxygen supply, or if there is any improper oxygen supply to the heart, then there occurs angina. So oxygen demand is greater than the oxygen supply in case of in case of angina. Let us see the factors affecting angina. Why angina occurs, or what are the factors which are affecting angina? That is contractility of the heart. When the heart contractility increases because of other drugs, or because of the age factors or whatever it may be, because of the contractility of heart in greater than what it is required, then we can see angina, that is decreased oxygen supply to the blood. And heart rate, when the heart rate goes down or when the heart rate increases then what it requires, then definitely there occurs decreased oxygen supply. And wall tension, the wall of the coronary artery will resist a kind of tension. When the artery cannot resist a type of tension, then there will be improper blood flow and there will be decreased oxygen supply to the heart. So, because of all these factors, there occurs ventricular pressure, because the pressure exerted by the ventricles or the volume of the blood which pumps out by the ventricles and the pressure with which the blood is pumped out, because of that, all these factors like contractility, heart rate and wall tension can be observed in angina. And the other factors include the difference of atriovenous oxygen pressure. The difference of the atrial as well as ventricular pressure or the oxygen or blood supply through between the atria and ventricles, the pressure exerted by these blood can cause like duration of the diastole, the diastole duration can be increased, or aortic diastolic pressure, the diastolic pressure exerted by the arteries can be increased, or coronary vascular resistance, that is the blood flow can be resisted or the blood flow cannot be in a proper manner because of the differences which occur in the oxygen pressure between arteries and ventricles. And because of all these reasons, coronary blood flow will be improper. Because of that, oxygen supply will be less in the case of angina. And there are few measures which we can record or which we can calculate the oxygen consumption of the heart. That is like there are two methods. One is double product method and the other one is triple product method. In the double product method, when we multiply the heart rate of the anginal person can be multiplied with systolic blood pressure, then we get a product, then we get a value. The value will estimate like how much oxygen amount is required to the body. And triple product, the other method is that the triple product method. Here the heart rate, systolic pressure as well as ejection time, the time by which the blood will be ejected out from the coronary artery. If these three parameters are multiplied, then the triple product can be calculated. By these methods, we can find how much oxygen is required for the heart. And diagnosis of angina. How we can diagnose whether the patient is suffering from angina or not. There are routine tests as well as optional tests. The routine tests which are usually carried out in the patient suffering from angina are ECG, that is electrocardiogram. The differences in the PQRST wave determines whether the patient is suffering with angina or not in the case of electrocardiogram. And the other one is stress test. The other one is echocardiogram. The other one is nuclear stress test and the other one is blood test. These are the routine tests which are done in the case in the patient suffering with angina. And second one is optional test. Whether in the severe cases, in the severe conditions of angina, we can go for this test, that is X-ray test. The other one is coronary angiography and the other one is CT scan. Next, what are the risk factors which are involved or what are the risk factors which leads to angina? One is age factor. As the age increases, there may be improper functioning of the heart and the most people who are aged are prone to cardiovascular disorders. And alcohol consumption. People who consume alcohol in more amount, they will suffer from this kind of cardiovascular disorders. Tobacco use. People who smoke. And the other condition is diabetes mellitus. The patients who are suffering from diabetes mellitus are prone to cardiovascular disorders. And the other one is elevated serum lipids. As the serum cholesterol or serum lipids are elevated, they get deposited into the coronary artery where occurs obstruction of the coronary artery leading to cardiovascular disorders. And the other one is high blood pressure. Because of the high blood pressure, narrowing of the blood vessel takes place and there occurs improper flow of blood in the coronary artery. And family history. If a person who has a family history of patient suffering from angina, then he may be prone to angina pectoris. The other one is obesity. Because of obese or overweight, angina can be occurred or other cardiovascular disorders can be occurred. Lack of exercise. If a person is not fit or do not do exercise in a regular basis, then also cardiovascular disorder chances are there. And the other one is sedentary lifestyles. People who don't take food in a proper time or who eat more junk food or their lifestyle is not routine, then occurs cardiovascular disorders. And the other one is stress, and the other one is based on gender. Next, let's see the causes of angina. We have shown the regular causes of angina. Let's see which diseases can even cause angina. One is coronary heart diseases, that is myocardial infarction or myocardial ischemia, where myocardial tissue is replaced by the fibrous tissue, and because of that the blood supply won't be in a proper manner, or there will be no blood supply to the heart, leading to angina. And the other one is coronary artery spasm. If there is any spasm in the coronary artery, also there won't be proper blood supply. And atherosclerosis. Atherosclerosis is one of the cardiovascular disorders along with angina can be occurred. Inflammation of the coronary artery. Injury of the coronary artery. If there is any injury or if there is any inflammation to the coronary artery, then angina can be caused. The other one is microvascular angina. We have discussed about microvascular angina. If the angina which occurs in the microvascular blood vessels, because of this microvascular blood vessel, there may be won't be proper supply even to the large coronary blood vessel, so that there occurs angina. We have saw the causes and physiology of angina. Let us see how the angina can be treated. There are non-pharmacological approaches as well as pharmacological approaches. Non-pharmacological approaches like changing our sedentary lifestyle and reducing the overweight if we are overweight, and if a person is prone to take more alcohol consumption should be limited, and we have to do more physical activity, that is increase aerobic physical activity. These are the non-pharmacological approaches where angina can be treated. The drug treatment, that is pharmacological approach. What are the drugs which are used in the treatment of angina? First class of drugs include nitrates or organic nitrates. Second class of drugs are beta blocking agents. Third class of drugs are calcium channel blockers. Fourth class of drugs are potassium channel openers. Fifth class of drugs are like miscellaneous other drugs which are used in the treatment of angina. Let's see one by one in the category. So, let us see the classification of anti-anginal drugs. We have saw the each and every category. Now, let's see the drugs which in each and category of anti-angina. Now, the nitrates. First, nitrates or organic nitrates. There are short-acting nitrates as well as long-acting nitrates. Short-acting nitrates include glyceryl nitrate or nitroglycerin. Long-acting drugs like isosorbide dinitrate, isosorbide mononitrate, erythritol tetranitrate and pentaerythritol tetranitrate. And these are the structures of nitroglycerin as well as isosorbide dinitrate. Why we are seeing the structure is that the NO, we'll see in the mechanism, the NO, nitric oxide will be released from these drugs. So that is why the structure of this nitroglycerin are important. Next, let us see the mechanism of action of these nitrates. So here from the organic nitrates or nitroglycerin, whatever the organic nitrates it may be, they carry NO2 group. So from this, when they get metabolized, nitric oxide, that is NO, is released from the organic nitrates, and this nitric oxide, it will help in increasing of or releasing of the guanylyl cyclase. Guanylyl cyclase, it converts GTP to cyclic GMP, that is guanylyl triphosphate to cyclic GMP, guanylyl monophosphate. This cyclic GMP in turn gets converted to GMP in the presence of phosphodiesterase enzyme. But here cyclic GMP is more important because cyclic GMP in turn, it reduces calcium influx. When calcium influx is reduced, then occurs smooth muscle relaxation. The other way is cyclic GMP, it dephosphorylates MLCK, that is myosin light chain kinase. Myosin light chain kinase is dephosphorylated, and because of that, the contraction of the smooth muscle will not take place, and thereby the ultimate result is relaxation of the smooth muscle. When the smooth muscles are relaxed, then there will be proper blood supply to the heart and we can reduce the angina to some extent. These are the first class of drugs, and these organic nitrates are used in angina pectoris, and they are even used in arrhythmia, and they are even used in bronchial spasm, cyanide poisoning. These are the few of the uses of these organic nitrates. The second class of drugs include beta adrenergic blockers. So beta adrenergic blockers, there are two categories of drugs. One is non-selective beta blockers and selective beta 1 blockers. There are three types of beta receptors, that is beta adrenergic receptors. Adrenergic receptors are of two types, alpha as well as beta. So in these beta type of receptors, there are three, beta 1, beta 2 as well as beta 3 receptors. Non-selective beta adrenergic blockers can bind to any of these three receptors, but whereas selective beta 1 blocker drugs, adrenergic blockers, will bind only to the beta 1 receptors. Let us see the non-selective beta adrenergic blockers like propranolol, nadolol, timolol, pindolol, labetalol. These are the non-selective beta adrenergic blockers. And selective beta 1 blockers include metoprolol, atenolol, esmolol and acebutolol. Let us see the mechanism of action. The mechanism of action of beta blocking drugs is very simple, that they inhibit the adrenaline which is released from the synaptic circle, the synaptic junction or circulation which is there. The adrenaline is released from those neurotransmitter. This is the neurotransmitter where it is released in the neurotransmitter junction and it gets bind to the beta receptor. But these adrenergic blockers, they prevent adrenaline to bind to the beta adrenergic blockers, and they in turn bind to the beta receptors, and thereby they result in smooth muscle relaxation, because when adrenaline binds to the beta adrenergic blockers, it occurs or it results in the contraction of the blood vessel. But here, when instead of adrenaline, beta blockers will be bind to the receptors, there occurs smooth muscle relaxation. Now, let us see the potassium channel activators, the other category of drugs. The drugs which are included in potassium channel activators or potassium channel openers are diazoxide, minoxidil, nicorandil and pinacidil. These are the few of the class of drugs which are included in potassium channel openers, and let us see the mechanism of action. How these potassium channel openers act. This potassium is useful in smooth muscle relaxation, or instead of calcium and sodium, if this potassium is effluxed into the blood vessel in more amount, there occurs smooth muscle relaxation. So this potassium is released into these potassium channel openers allow the potassium to efflux or get into the blood vessel, and when there is more amount of potassium in the blood vessel, decreased calcium and sodium levels will be there, which leads to smooth muscle relaxation, because calcium will result in it provokes the blood vessel to contract. But here potassium channel openers, because of the hyperpolarization, it leads to smooth muscle relaxation. And this is the mechanism of action. Like when potassium channel openers allow the potassium to enter, or the potassium efflux is done into the blood vessel, then there occurs membrane hyperpolarization. When membrane is hyperpolarized, there will be decreased calcium entry into the blood vessel. Because of that, smooth muscle relaxation will be there. Next, see the other class of drugs that are calcium channel blockers. In the calcium channel blockers, we have three categories. One is phenylalkylamines, and the other one is benzodiazepines, and the other one is dihydropyridines. These are the three class of drugs in the calcium channel blockers. The first class of drugs are phenylalkylamines. The drug which comes under this phenylalkylamine category is verapamil. And benzodiazepine category include the drugs called diltiazem. And in dihydropyridines, there are three generation of drugs. First generation, second generation, as well as third generation of drugs. First generation drug include nifedipine, and second generation drugs include isradipine, nicardipine and felodipine. And third generation of drug include amlodipine. This is the classification of calcium channel blockers. Now, let us see the mechanism of action. Mechanism of action of calcium channel blockers is very simple. The receptors have calcium channels, they allow the calcium to enter into the blood vessel. Because of the entry of calcium into the blood vessel, there occurs contraction of the blood vessel. But here these calcium channel blockers, they won't allow, or they block the entry of the calcium into the membrane or into the blood vessel through the membrane, because these receptors or these calcium channel ions openers or these calcium channels are present on the membrane. So when they block the calcium entry, there will be decreased calcium efflux into the blood vessel, and thereby because of that contraction will be less and smooth muscle relaxation will be takes place. Next, there are few of the miscellaneous drugs which are used in the angina. The first drug is dipyridamole. Dipyridamole is a powerful coronary dilator. When we intake dipyridamole, it immediately acts on the smooth muscle or coronary artery and it dilates the coronary artery. When the coronary artery is dilated, then definitely there will be proper oxygen supply to the blood, and it does not afford symptomatic benefit or avert ECG changes. What does this mean? When dipyridamole is taken, then there won't be any averts or there won't be any disturbances in the ECG changes also. And this dipyridamole, it also inhibits platelet aggregation. That is, if there is any blockage of or if there is any coagulation in the coronary artery, then the dipyridamole inhibits the platelet aggregation or coagulation of the blood. And it is usually employed or it is usually used in the cerebral thrombosis in post myocardial infarction and post stroke patients. The patients who have taken the treatment for myocardial infarction and stroke, after this post myocardial infarction and post stroke conditions, the cerebral thrombosis can be treated when dipyridamole is used in those kind of patients. The other category of drug is trimetazidine. This is also another class of miscellaneous drugs which is used in treatment of angina. How does this act? It prevents degradation of membrane unsaturated fatty acids by lipid peroxidation. That is, what does it do? The unsaturated fatty acids which are there, it prevents the entry of those unsaturated fatty acids into the membrane. When these fatty acids are degraded, the result is cholesterol. When this cholesterol is released into the blood in over amount, then there occurs deposition of cholesterol in the artery. When this coronary arteries are deposited by plaques, that is lipid plaques, then there will be narrowing of the blood vessel. So it inhibits the degradation of unsaturated fatty acids to form cholesterol by reducing myocardial oxygen demand. And the other one is it also inhibits superoxide cytotoxicity. Superoxide is another free radical which allows the blood vessel to get contracted. So when this superoxide free radical is inhibited, then there will be decreased toxicity in the body, and because of that there will be no any harmful effects of ischemia. Because of ischemia, angina can be caused. So the ultimate result is anti-anginal action of trimetazidine. And the other drug is ranolazine. Ranolazine, inhibition of late inward sodium current in myocardium during ischemia. So when sodium is increased in the blood vessels, sodium and calcium, they ultimately result in the contraction or contractility of the blood vessel. So when this sodium inhibition or sodium efflux is inhibited into the blood vessel, then there will be decreased contractility or increase in the smooth muscle relaxation. Even the same with calcium load also. When the calcium is entered into the blood vessel, there occurs contractility. So ranolazine prevents sodium as well as calcium to enter into the blood vessel in more amount. That is the reason it acts as cardioprotective drug. And the other effect of these, or the other effect by which ranolazine acts, is it inhibits fatty acid oxidation. When fatty acid gets oxidized, ultimately lipids or triglycerides will be released into the blood vessel. So that is the reason lipid peroxidation is also inhibited by this ranolazine. And it does not affect in any heart rate. When the ranolazine is taken, it will not affect any heart rate, or it will not affect with the blood pressure also. That is the best part of this drug. The other one is oxyfedrin. Oxyfedrin is a drug which is also used in the treatment of angina. what does it do? It can improve myocardial metabolism. Claim to improve myocardial metabolism. So the metabolism which occurs in the myocardial tissue can be improved by this drug. When myocardial tissue starts working properly, then there will be functioning of the heart takes place in a proper manner. So this is how this drug acts. Let us see the uses, effects, side effects and contraindications of these anti-anginal drugs. The first class of drugs are nitrates. The uses of these nitrates are discussed already, like they are used in angina pectoris, they are used in bronchial spasm, they are used in hypotension also in few cases, and the other one is cyanide poisoning. And let us see the effects. What are the effects? What happens if we intake nitrates? So when nitrates are intaken, smooth muscle relaxation takes place, because all the category of anginal drugs, the final result should be smooth muscle relaxation only. So smooth muscle gets relaxed. Preload reduction and after load reduction. What are this preload and after load? These are the loads or the pressure with which the blood is exerted by the walls of the blood vessel. So because of that pressure, there may be occur tension or load on the heart. That is, preload and after load can be reduced. When these loads are reduced, then definitely hypertension will be reduced. When hypertension or blood pressure is reduced, then there will be less risk of angina. And the other one is a redistribution of coronary flow. That is, if there are any plaques also, because of these nitrates, those aggregation or plaques will be dissolved, and when the plaques get dissolved, coronary flow will be properly distributed, or there will be proper flow in the coronary arteries. And the side effects. Let's see the nitrate side effects, because each and every drug has side effects. Let us see what are the side effects of nitrates. There will be throbbing headache, that is severe headache. Methemoglobinemia. What does this methemoglobinemia mean? Usually in the blood, the ferrous ion, that is Fe2 plus ion is present. But in methemoglobinemia condition, instead of this ferrous ion, ferric ion is replaced, Fe3 plus. When this replacement takes place, then the condition called methemoglobinemia occurs. And there will be rare rashes, palpitation occurs, and there will be weakness. And the contraindications, when these nitrates should not be taken, or when these nitrates are contraindicated. This nitrate should not be taken with sildenafil citrate, and the other one is this should not be given in hypotension condition, because in hypotension condition, when we give this nitrate, smooth muscle relaxation will be more, or there will be decrease in the more blood pressure, which may potentiate the condition of hypotension. And the other one is myocardial infarction. When the patient suffering from myocardial infarction, nitrate should not be given. And vasodilation case also, the nitrate should not be given. And the other class of drugs are beta blocking agents. These beta blocking agents have various uses, like they are used in hypertension, they are used in arrhythmia, they are used in angina, and various other uses of beta blocking drugs. And let us see the effects. What are the effects caused by these beta blocking drugs? When these beta blocking drugs are taken, then there will be decreased heart rate. If there is any increase in the heart rate, or the condition, or when there will be increased heart rate, when these beta blockers are taken, they will reduce the heart rate. And decreased force of contraction, the force with which the artery gets contracted, that can be reduced. And decreased conduction, the conduction of impulse which will take in the heart, that can be decreased. Decreased myocardial oxygen demand, the demand for oxygen for myocardial tissues can be reduced. That is, increased oxygen supply. This result, when decreased oxygen demand is there, then will be increased oxygen supply. And improves ischemia. Ischemia is a condition where myocardial tissue gets damaged. So this myocardial tissue damage can be improved by beta blocking drugs. And CHF, that is congestive heart failure and migraine. So these are few of the effects which are caused by the beta blocking drugs. And side effects. Let us see the side effects of these beta blocking drugs. Decrease work capacity, fatigue, we get tired very easily, and loss of libido. Libido in the sense getting used to social or getting socialized. So people who take beta blocking agents, they won't be socialized more. They want to be lonely, or they won't mingle up with others. And nightmares, they may get nightmares, severe nightmares, The other effect is increased triglyceride levels. When we take beta blocker drugs, triglyceride levels will be increased, and LDL and HDL ratio, that is low density lipoproteins and high density lipoproteins. There are good cholesterol as well as bad cholesterol in the body. Good cholesterol is HDL, high density lipoproteins, and bad cholesterols are triglycerides, VLDL, very low density lipoproteins, chylomicrons, and LDL, that is low density lipoproteins. When LDL and other lipids increases, then there will be more prone of or more risk of atherosclerosis. When HDL is increased, there will be less risk of atherosclerosis. And the contraindications, when should these beta blocking agents should be contraindicated or should not be used? Bradycardia. Bradycardia is a condition where there will be increased force of contraction of the heart. So these beta blocking drugs should not be given when bradycardia condition is there, and prinzmetal angina condition is there, and COPD, that is coronary obstructive pulmonary disorder. In this condition, the beta blocking agent should not be given, and dyslipidemia and pheochromocytoma, smokers and old hypertensive, that is who took or who already taken medication for hypertensive. In these conditions, the beta blocking agents should not be given or should be contraindicated. Let us see the other class of drugs, potassium channel openers. Potassium channel openers also have various uses, like they are used in angina, they are used in arrhythmia, they are used in diuretics. So let us see the effects. What are the effects which are caused due to potassium channel openers? So potassium channel openers lead to smooth muscle relaxation, decrease myocardial stunning, and increase coronary flow. And let's see the side effects of these potassium channel openers. It causes flushing, palpitation, weakness, headache, dizziness, nausea, and even painful ulcers in the mouth. When these potassium channel openers are taken in more amount or in the high dose, then these side effects can be occurred. And contraindications. These potassium channel openers should not be given with anti-diabetics. Anti-diabetic drugs should be, or else the patients who are taking anti-diabetic drugs should not use potassium channel openers. And the other class of drugs are calcium channel blockers. So calcium channel blockers uses are like they are used, the most use of calcium channel blockers are arrhythmia. They are used in arrhythmia, they are used in angina pectoris. And let us see the effects. What happens if calcium channel blockers are taken? In the elderly patients, cheap, quick action or no sedation will be there. In the elderly patients, the sedation will not be there, or there will be very quick action of calcium channel blockers. And the other one is anti-arrhythmic, very specially verapamil. Anti-arrhythmic activity will be there. And the other one is neutral on lipidemia. It won't act on lipids. These calcium channel blockers would not affect any of the lipid parameters in the body. And they are used in vasospastic angina and asthma. So these drugs are also used in vasospastic asthma, vasospastic angina as well as asthma. Let us see the side effects of these drugs. When calcium channel blockers are taken in overdose, then what are the side effects which are seen? First one is fluid retention. The fluid or the water or whatever fluids it may be, when it gets retented, then there will be increased blood pressure in the body and may worsen congestive heart failure. If a person suffering from congestive heart failure takes calcium channel blockers, the condition may be synergetic, or there may be synergetic effect, or the congestive heart failure condition may be potentiated. And gastroesophageal reflux. Gastroesophageal reflux condition also, calcium channel blockers should be avoided, or it will cause gastroesophageal reflux if calcium channel blockers are taken on overdoses. And the other one is ankle edema. In the ankle we can find edema. And difficulty in bladder voiding. So there will be the bladders, urinary bladder functioning will not be proper, or it may cause improper functioning of the urinary bladder when calcium channel blockers are taken on overdose. Let us see the contraindications. When should these calcium channel blockers should be contraindicated? In tachycardia condition, that is increased heart rate condition, that is tachycardia, this calcium channel blocker should not be used. And the other one is arrhythmiasis case. This calcium channel blocker should be contraindicated if the person is suffering from both arrhythmia as well as angina, or the arrhythmia in combination with other diseases. And congestive heart failure and volume overload with beta blockers. When beta blockers are taken, there will be overload in the volume of the blood. So in this condition also calcium channel blockers should be avoided. So these are the anti-anginal drugs and the pharmacology of anti-anginal drugs.